Hello, dear listener, and welcome back to the Neurotransmitters, your everything neurology podcast. We are your hosts. I am Dr. Michael Kentris, and I am joined, as always, by Dr. Galina Geichman. How are you today, Galina?
Hey, Michael. I'm doing well. Thanks a lot for having me back on. And hi, listener. Thank you for listening.
So, the people who've been paying attention have noticed that we've been doing these recordings together. And so, I want to thank you, Galina, for kind of giving me a shot in the arm for improving the regularity of our show and breathing some new life into it. So, first of all, thank you for that.
Well, Michael, thanks for having me. And thank you for the kind words. It's really been my pleasure. I think you're right. We all need a accountability buddy. And I have not had this much fun with my CME for years. So thank you so much for the chance to be on the show.
Absolutely. So we've been covering in our Chief Concern series, many of the most common complaints. Gosh, I know, complaints, so negative. But many of the things
concerns, Michael, concerns.
I know, concerns. I can't help it. It's been beaten into me for over a decade. But we've been covering some of the most common things that we're likely to see in neurologic practice, particularly on the primary frontline side. And we are now kicking it up to 2.0. So what can our listeners expect as we go forward in this series?
Well, just to review what we've covered, we really focused initially on thinking about essentially the diagnosis of some of these common concerns. So when a person comes into your clinic, what do you do on history? What do you do on exam? What do you do with that initial workup? Such as, for example, we've covered the approach to dizziness, the approach to headache management, kind of at that frontline level, the approach to a undifferentiated gait disorder. And what all these had in common was that we didn't quite get to that second level of management and second level of more complexity. Because of course, if it's the simple thing, it's the simple thing, but many of the times it's not a simple thing, or that first pass diagnostic approach may not reveal the answer. And so what we thought was for those dear listeners who've gone through, step one of the course and are ready for step two, we really wanted to get into a little bit of that, what comes next. So as I mentioned, the first thing that we're going to be doing in the second part of the series is revisiting a few of the topics and diving into management. Again, at that first initial level, but then also the next step. And I'll throw it back to you about what topics we're going to start with. And then for a few of the topics, they'll feel not so familiar. There'll be potentially new topics where we're going to get into kind of how we think about them. And some of these topics are those that may not necessarily be seen at the primary care level, but they might be seen at the primary neurology provider, whether it's a generalist or a neurology APP who is managing lots of general neurology in their practice and wants to get a little bit more up to speed on some of the subspecialty topics.
Well said. We will be having some familiar voices, if you will, joining us again, talking about, as you said, tremors, dizziness, neuropathy, balance issues, some of the kind of bread and butter things, and hopefully we'll be getting into some of the more challenging topics, such as perhaps selection of anti-seizure medications, selection of MS medications, and really getting kind of into some of those brass tacks in terms of how do you dose such and such a medication? Which do you prefer to start with? Which, can be a nest to get into all on its own in terms of which medication and why. And I find that in my own experience, the answer is usually it depends, which I had a medical student shadowing me recently who called me out on that because patients would ask me, it's like, well, what do you think about this? And I was like, well, it depends. And apparently I say that a lot. So my apologies to everyone who's had to listen to me talk. But I'm hoping to take away some lessons myself from some of these conversations and start to talk with some of our colleagues about some of these, once we kind of get into their unique perspectives on management of these common conditions. And we will be eventually moving into more esoteric topics as well, things that the general neurologist might struggle with or might need to be tapping a subspecialist for. And so we definitely plan to continue this kind of down the rabbit hole. And we hope you guys are all along the ride with us.
Yeah. It's incredibly exciting for me as well. I think your point about it depends is a good one. It depends on the individual practitioner, depends on the patient in front of you, depends on your area of practice, and also are you in an urban setting, rural setting? So I think that we absolutely recognize that listeners around the country and maybe around the world will have a different experience than us. And so we welcome you to call in, to debate, to share your experiences, or to ask your questions, to which we'll try to answer something other than it depends, but we'll see what the question is. And the idea being that this is just a way to upskill all of us a little bit more. Those of us, like, for example, my practice pattern as a general neurologist working in an academic medical center is very different than someone who's a general neurologist elsewhere. And so there are things that is part of my bread and butter that maybe isn't part of someone else's, and vice versa. And hopefully we're demonstrating here not just that there is a right answer out there, because there often isn't, but that there remains a kind of curiosity in one's career over time for continuous learning and improvement. And I'm certainly excited to upskill myself, as I said, and hopefully it trickles down to some others.
Very true. Very true. I feel like I learned so much from having these conversations with people and picking up new tips and tricks. And I want to reemphasize what you said, Galina, that we very much want our listeners to write in. We don't have a phone line to call in, but there is a little
record
link.
Your voice and send it in.
That's right. We could set up a speak pipe. Maybe we'll do that. If we do, it will be linked in the description below. But if you don't want to record yourself, you can always send us a text message via the link in the show notes. You can send us an email via our website at theneurotransmitters.com. Or you can find us on X and send us a DM at neuro_podcast. So we would love to hear from people about comments on past episodes, suggestions for future topics, questions for future experts, as well as if you are interested, if you yourself are a neurology professional and interested in coming on and doing some teaching, reach out to us. Or if you have someone you would suggest that we reach out to. All suggestions are welcome, even though all may not be taken up, but we will definitely read them. So yeah, I think this is a great chance for us to kind of engage with our neurology community at large and see what is it that people want, and can we provide that for them?
Yeah, I'm not going to call them out by name, but I do want to give a shout out to those who've already written in. It means so much to us that what we're sharing has been educational, has changed your practice already in some ways, has given you either more knowledge or just more confidence about how to proceed forward. So we do read them. It means a lot to us. And we're so excited that many of you are joining us on this journey.
Yes. And, for those, since this is kind of an educational venue, I do want to make sure that we plug Galina's other podcasts, Neuropraxis. So for those who are interested, what's your elevator pitch for that podcast, Galina?
Thanks, Michael. That came out of left field. I thought we were here for our Chief Concern series, but it's very kind of you to ask. So I had the distinct pleasure of starting a podcast last year, started in November, and we've been publishing monthly since. It's the Neuropraxis podcast, the neurology education podcast. And credit to you, Michael, for inspiring me and giving me the behind-the-scenes mentorship to make this possible. So look out, everyone will at some point have an episode on mentorship, and this was a great example of that. But really, we cover all things neurology education. So a little bit less content. So we're not teaching about neurology, but we're teaching about teaching. So it's covering the latest in neurology education research, thinking about how theory can inform our practice as a clinical teacher or an education researcher, and also hearing about the often, as we say, ataxic and not straight and narrow career journeys of people in neurology education, how they came to find that identity as an educator, develop themselves, and build a career around it. So if any of that sounds interesting, we'd absolutely love to hear from you, and hope you hear from us, and maybe we can include a link to that as well.
Absolutely. And, I'm just going to keep, inflating your ego. So the other project Galina's working on, which I'm a huge fan of also, is the Neurohumanities Network, and we do have some interviews planned on the horizon with her and her team members about that. But again, would you give us another elevator pitch for your other project?
Okay, got it. I'm getting the drift here now. Thanks again, Michael. So
shameless self-promotion is our theme today, listener.
So our Neurohumanities Network is another passion project. It was something that was started together with Mattia Rosso and Charlie Palmer, and the two of them had an in-person network of neurohumanities enthusiasts at MUSC where they were residents. And that translated about 2 years ago into an online community that we formed. We offer monthly seminars on any topic, and truly any topic at the intersection of arts, humanities, and neurosciences. So can cover various clinical fields like psychiatry, neurology, neurosurgery, but also we'd love to hear from people coming in at a different angle. So artists and those who are humanists, for example, philosophy professors, or just people who want to share their thoughts. But we have a monthly cadence of these webinars with some chance for Q&A discussion. And then we have quarterly what we call booster sessions, where you can roll up your sleeves and actually engage in arts and humanities practices yourself. So we've done things like culinary arts, following a recipe, and doing poetry readings, music listening, yoga nidra, meditation. And next week, we have our virtual online community mindful tea tasting. So lots of different ways to get engaged. Use all of your senses, vision, hearing, smelling, tasting, to enjoy the world of arts and humanities and its implications for us as neurology providers, and really trying to instill that humanism back into our practice.
Yeah, it has been so neat to watch that thing develop. I haven't been able to make it to as many live sessions as I would like, but even just watching the YouTube recordings after the fact, it's some very fascinating stuff, and definitely I think it's kind of the stuff that gets you, that, like back when you were first thinking about becoming a neurologist or a psychiatrist, and, why is the brain so cool and why does it matter? And just really kind of taking in the bigger picture at large. And then, as you said, you really drill down into some of those details of the neuroscience in some of those sessions too. And it's very fascinating. A lot of very interesting perspectives, interesting speakers. So I can't recommend it enough. But very cool stuff, and I'm looking forward to talking with you and your other co-founders about this in the not too distant future. So should be very fun. And yes, we'll include links to both the Neuropraxis podcast and the Neurohumanities Network YouTube channel.
Well, I will just say one quick point further about the Neurohumanities Network, and maybe this is a prelude to our conversation about it, but it was just a nice reminder, as you said, like these are the reasons that got us into training. And it's very true. And I think that what's often missed, I think, is the fact that these skill sets and this interest is not, it shouldn't be separate from our training. It's not like it brought us in and then we have to like re-find it. And I think that we too often discount it in our training. And part of what we're doing with the network is trying to show that close observation, humanistic practice, like a sense of what, reading the room, situational awareness, having the type of inquiry that we approach in arts and humanities is actually part and parcel of our work as a clinician. And I think we've been doing a little bit of that here too, talking about the way someone describes their symptoms matters, the way they experience them matters. I mean, I still remember Marcus and like all his tips about like how this neuropathy actually feels, like heavily diagnostic. Right. And so it's been really fun to see these threads of connection, to weave this tapestry between the two topics. But yeah, I think we're all trying to find a way to integrate it in our practice. And hopefully we can bring a little bit of the art, shall we say, of medicine here to this work as well, not just the science of it.
Right. It's a good reminder that your patients aren't just a bundle of symptoms waiting around for you to disentangle them and diagnose and treat, that they are people with their own lives and experiences, and giving like you said, just a broader perspective. So it is good, right? We focus perhaps too much on the neuro and not enough on the humanity in our day-to-day practices. Because, neurologic symptoms, they're nice, neat, clean lines. At least we like to tell ourselves that. But humans are messy and noisy and make you tired.
Yeah, no. The neurological diseases tend to paint outside the lines.
Right.
They don't follow the paint by numbers.
I know, right? It's what you learn in the textbooks versus what you see on the wards and in the office. So it's a good reminder of the many varied experiences that can make up, daily life for the average person. So great work over there. Any final thoughts, Galina?
Well, let me turn it back to you, Michael, because you asked me what I'm doing when I'm not on the podcast. But how about you? What's keeping you busy these days? And you've always got something interesting going on.
Sure. So yeah, I guess we'll do a little life updates. But let's see. So I'm doing a lot. My wife and I have a small plot of land. So I've been working on a chicken coop lately, which has been taking up a lot of time. And then I believe Galina's referencing, before we were recording, I've been working on a project completely not neurology related.
Well, it's a neurohumanities project, so it's very fitting.
I suppose. It's more...
Or I guess humanities.
Humanities. My brother and I are doing another recording for a podcast called Brothers Reading Books. So, my brother Will and I are both sci-fi fantasy nerds. Surprise. And we have been recording ourselves going through some old science fiction books. We started off with Dune, and we have been moving through Conan the Barbarian short stories, and we are planning to jump back into science fiction after we finish that. So we've got around a dozen episodes or so at the time of this recording up. So if you are interested in listening to two people talk about books, particularly older science fiction and fantasy, feel free to check it out. I had one of my friends actually listen to it. So my brother and I have voices that are very similar sounding to one another. And someone accused me of just setting up two different microphones and moving back and forth between them and recording myself talking to myself. That is not, in fact, what happened.
That would be very sci-fi.
Right? It's just the unreliable narrator trope. But no, there are two of us. We just sound alike. It's been like that since we were kids. We'd answer the phone back when people had landlines, and our parents would even ask which one of us it was. So that does happen. But yeah, we go into pretty in-depth stuff. It's not neurology related whatsoever, but it is on the humanities side of things, I suppose. So I guess that's my other side project that's been going on. But I would say for anyone out there, the bar for podcasting is so low. And it's been a great excuse to just, my brother and I live in different cities, and we don't talk as much as we should. So it's been a great excuse for us to meet up on a relatively regular weekly basis, talk for about an hour or two, and just have a good time, nerding out. So I would encourage anyone who's interested in podcasting to, start it up. Even if you're just doing one for family. People who are interested, I do recommend the Buzzsprout official podcast, Buzzcast. Hilarious, run by the administrators over there. So if you're interested in podcasting, it's not necessarily the most brass tacks thing, but it talks a lot about kind of the philosophy of podcasting and the why of podcasting. And they're very passionate people about podcasting. That's why, in part, this is an audio-only recording. I often am listening to podcasts and audiobooks when I am working around the house and out in the yard. And so I need to be looking, if I'm operating like heavy machinery at what I am doing. And so I'm very much in favor of an audio first format. And that is why the Neurotransmitters remains an audio podcast as of this day. So anyway, that's a little bit of my own philosophy of podcasting. But yeah, real conversations, as Galina knows. We did not script this whatsoever, so we are just meandering. But we will not keep you on the hook too much longer, listener. This is more of a life update, podcast update. And as always, thank you for listening. Galina, anything else you'd like to add?
Yeah, no, I thank you for taking us back to the roots of the philosophy, because I will say, you started with saying thanks, and I'll just say thanks right back to you, because I think the Chief Concern series is really just that. It's neurologists chatting about how we how we think about these things without, that sense of a right answer or a scripted objectives or a clear, approach to the teaching. And so we understand it may not work for everyone. If you're looking for that like board review, you may not get it here. But if you're looking for honest conversations and embracing of the uncertainty that is the work that we do every day and finding the humor in it, hopefully you'll join us for part 2.
Yes. No, I think that's a great point, that there are people doing that work of the board review and the journal article updates and, like the official stuff from the AAN or the Neuro Review podcast. I think it's from the folks at Yale, if I remember right. Great stuff. We're messier over here, and that's the way we like it. So, but I enjoy very much what they do as well. But there's good people already doing it, and I'm happy to kind of get into the weeds where things get a little fuzzier. We're working on our level U evidence guidelines over here, where expert opinions only. No, that's not entirely true, but I do appreciate them very much. So yes, thank you all for listening, as always, especially to this particularly meandering recording today. Well, maybe we'll clean it up a little bit, but probably not. But again, if you want to reach us, you can click the link in the show notes. You can text us. You can email us at theneurotransmitters.com. And you can always send us a DM on X. I think we're on Instagram as well, although not as active lately. Neuro_podcast. So thank you all for listening. And we'll be coming back with our second iteration of the Chief Concerns.
Thank you, everyone.